Well, yesterday, we took a look at the real-life world of pediatric trauma. Today, we're going to take a look at what we much more commonly encounter, which is downright sick medical kids. Well, before we can take a look at sick kids, let's take a brief look at healthy kids. What do we know about healthy kids? Well, healthy children, just like many adults, have saggy chests, fleshy arms, pudgy thighs, and a flabby tush. That's normal. All you have to do is water your baby and watch them grow. And when children indeed grow up, they are going to grow up to be one of two kinds of children. And this is inevitable, right? Option A, hurry up, dear brother, that's mom calling us. Yes, we simply must get home and assist mother with our household duties. Is this real? No! Y'all know this. If any of you have kids, if you've ever thought about having kids, if you've ever interacted with kids, at any point in your lifetime, this is not realistic. Therefore, what is something we see just a tad more commonly? Simply this. So as we take a look at sick kids this morning, the first thing we need to address is best described as sick or not sick. Because across the board, whether you're a nurse, a medic, an RT, you simply have way too many numbers to memorize. Therefore, what's much more important is to use your gut, use your intuition, use your experience, whatever you want to call it, use it. Look at the kid and say, you know what, they look sick, but they don't look sick. So if we look from a neurologic perspective, we'll talk about level of consciousness in just a little bit. There is a fancy pediatric Glasgow Coma scale. Fontenelle's, if you remember, a big fancy medical term for holes, soft spots. The moral of the story, you've got them, use them. Remember, they heal over at about a year and a half or so. But if they are present, they're a wonderful way to tell what's going on inside of your kid's head. The reason being, I tell you got a 6-month-old kid with a 7-day history of D&D, or diarrhea and dehydration. How's the soft spot? It's sunken. Temperature of 104, stiff neck and actively seizing, bulging. You've got them. Use them. Activity level. How many nurses or medics does it take to start an IV on a perfectly healthy 2-year-old? Exactly. It's like this half of the room, and very appropriately so. It's the kid that's, quote, such a good baby. He didn't even flinch when I did his blood gas. That's not right. Now, in regards to parents, you know there's only two kinds. Reliable parents and not reliable parents. Not reliable parents, take them out of the equation. Reliable parents are great, though, in 3 categories of kids. Number 1, seemingly absolutely nothing wrong with you kids. Why? They present saying, my child appears completely and utterly normal, I'm sure, to you, but they ain't right. Do you believe them? Absolutely. Is it life-threatening? Oh my gosh, no. But they know the ins and outs of their kid much better than you would ever care to. Believe mom. Take that one step further, and that's called children who survive 6 months in the neonatal ICU. As we'll show you later this morning, the babies we are now saving are unbelievably small. They fit in the palm of your hand. They weigh substantially less than a pound. And no surprise, a fair amount of them die. However, in the event that they do survive, a decent percentage have some sort of delay. They're not what lay people consider normal. Therefore, what is important is simply ask mom, what is normal for your kid? Say, mom, is it normal your child has 12 grand mal seizures every single day? All right. So why did you call 911? Lastly, as children who have XYZ syndrome. XYZ syndrome is something that you have never heard of, that your pediatrician or your ER doc vaguely remembers hearing about in medical school. How do you know this kid has XYZ syndrome? They're an FLK. What's an FLK? Funny looking kid. Anytime you've got a funny looking kid, ask mom. Because chances are mom is a regional expert on XYZ syndrome. And in 30 seconds or less, she'll teach you what you need to know. Therefore, neurologically, sick or not sick? That would be sick. Why? Number 1, I have a picture of him. Always a bad sign. Number 2, lots of tubes and wires. Number 3, I'll give you a clue. Look at the face. What do you see? Kids grimacing. Why is that an issue? Because when you're 4 days old, what exactly are your responsibilities in life? Well, you actually have 5. What do you have to do? Eat, sleep, pee, poop, and breathe. That's all the human being has to do on any given moment. Therefore, look to your kids' faces. If they look stressed out, something is not right. As they get older, they should be tired, cranky, fussy, whiny. That's appropriate. They're sick. They feel miserable. We stick them with needles. We give them great tasting medicine like Prelone and say, here, drink this. It's when kids look like this. And you haven't given them any Versed or chloral hydrate to make them look like this. That should make you wonder. Now, remember yesterday we said everything in kids is respiratory. And if it's not respiratory, it's probably respiratory. And that still holds true today. Therefore, from a respiratory perspective, how are children exactly like big people? Breath sounds. They've got rhonchi, they've got rales, they got wheezing, absolutely no difference. However, difference number one, they breathe faster. True. So what's the fastest you've ever seen a little kid breathe? 80, 90, 100. For me personally on transport, it's 136. Which really is quite amazing when you think about it, because that's more than 2 breaths every second, like a little hummingbird this little baby's trying to breathe. Even more amazing was the fact that the kid was pinworm dry, had a SAT of 100, was actively sucking on a binky. However, what do we know about this is how long is this kid going to keep breathing 136? Not long. Why? This is where, in many ways, kids are different than big people. Why? What do we know about big people? Do big people ever die? Well, technically yes, but if they do die, it takes them forever to die. And kids are not that way. Kids, as you know, are going to go 136, 136, 136, 0. And people don't like that. They like that whole in-between period that adults give you. Kids don't. Therefore, get them when they're breathing 136, the kid is going to do great. Wait for them to not breathe at all. As you can imagine, the outcome is not quite as good. Now, worse than breathing fast is breathing hard. When you breathe hard, remember you're retracting, and all you're trying to do is get more air in and out of your chest. Now, it's important to be able to clarify not only that the kid is retracting, but where the kid is retracting. And the reason being, 2 o'clock in the morning, you wake up a pediatrician, you need to clarify 2 things. Number 1, the kid is sick. Number 2, this is why I think the kid is sick, and therefore give me the orders for what I want, or for what I've already done, and hope you're going to give me the orders for. Which means if you wake up a pediatrician at 2 in the morning and tell them the kid looks sick, and they're retracting a lot, are you going to get what you want? Yeah, maybe no. Depends on whether they know you and trust you. You want to get somebody's attention at 2 o'clock in the morning? Tell them the kid's sternum is physically touching their spine. You tell anyone in pediatrics or emergency medicine the kid's sternum is physically touching their spine, they will sit up and take notice. However, long before you hit sternal to spine retractions, what do we call it if you retract underneath your costal margin? So right here underneath your rib cage, those are called subcostal. Sub is like a submarine, means below. Costal means costal. So it's underneath your costal margin. How about in between your ribs, hint, hint, in your intercostal space? What kind of retractions are those? Intercostal, very good. And how about above your clavicles? What kind are those? Supraclavicular. Why? Supra in rudimentary Latin means above. Clavicle means clavicle. Therefore, underneath is subcostal, in between intercostal, above supraclavicular, you have a much better chance of getting what you want. Now, worse than breathing fast, breathing hard. Worse than breathing hard, certainly not breathing at all. Somewhere in the middle is called grunting. When kids grunt, it's a child's way of saying, hi. In the relative near future, I'd like an endotracheal tube, please. Now, do you have to intubate every kid that grunts? Absolutely not. But it's something that ought to pop in your head, because just like turning purple, just like dropping your blood pressure, it's a really late sign. Now, think about it. Normal, healthy babies. When you inhale, your air sacs open. When you exhale, they close. Next breath, they open up again. Not an issue. Life is good. The difference is when you have bad lungs for whatever reason, when those air sacs close, it's a bugger to get them to open up again. So what they do is they exhale. And at the same time as they exhale, they take their epiglottis and their vocal cords at the top of their airway, and they slam them shut like a trapdoor. So that expiration, all in your chest says, let me out, let me out, let me out. The very top of your airway says what? You can't get out. and it makes the pressure very high in your chest and it actually creates PEEP, or positive expiratory pressure, just as if you had the kid on a vent. They don't have a hard time breathing. They don't say, I think I'll grunt. But in the event that they do it, it really ought to scare you.